What would happen if I told you there's a scientifically proven sexual technique that most women dream men would know, but almost nobody applies? And no, I'm not talking about an impossible Kama Sutra position or something you need to be an Olympic athlete for. It's a simple adjustment, a shift in approach that can completely transform your partner's experience. As a urologist with over 25 years of practice, I can assure you that the biggest mistake I see, the silent complaint behind so many consultations, is the frustration that comes from intimacy that simply isn't satisfying. And almost always the problem lies in a fundamental misunderstanding about how the female body works. Many men focus only on penetration, on the in and out, and completely ignore what science and anatomy tell us. But today, that's going to change, gentlemen. Forget everything you thought you knew about sex. I'm going to introduce you to the Coital Alignment Technique, a method that isn't a trick, but rather a brilliant anatomy-based strategy that maximizes contact exactly where it needs to be. Stay with me, because I'm going to explain step by step the scientific foundations and how this knowledge can change your intimate life forever. Before continuing, if this video is being useful to you, give it a like and subscribe to the channel. And if you're ready to transform your sex life, write a 1 in the comments. Look, let's be clear. For decades, popular culture and pretty deficient sex education have transmitted a very simple idea of sex. And, to be honest, a wrong idea. Everything focused on penetration as the main event, the only path to orgasm. This created what sexologists call the orgasm gap, that huge difference between how often men reach climax and how often their partners achieve it. And the numbers don't lie, gentlemen. While most men say they almost always reach orgasm from penetration alone, studies show that barely 20% of women can say the same. And careful, this isn't a women's problem, it's a technique problem. The issue isn't that women are complicated, it's that most men are ringing the wrong bell. To understand this, let's take a quick look at anatomy. The absolute protagonist of female pleasure is the clitoris, this organ that has one single purpose, to provide pleasure. What you see on the outside is just the tip of the iceberg. Inside it extends into a complex structure that surrounds the urethra and vagina. And here's the crucial fact, my friend. The clitoris has over 8,000 nerve endings. That's double what the penis has. Now think about the mechanics of the traditional missionary position. The movement is pure in and out. In this direct and constant dynamic, contact with the most sensitive part of the external clitoris is minimal or simply doesn't exist. It's like trying to light a fire by rubbing 2 sticks 3 feet apart. It's simply not efficient. Millions of couples experience this frustration. They feel something's missing and feel confused, sometimes even inadequate, because they have the sensation they're doing everything they're supposed to do without anything happening. Let me tell you about Robert's case, a 52-year-old engineer from Chicago. He came to my office with his wife after 20 years of marriage. He confessed something many men feel, but few admit. "Doctor, my wife almost never reaches orgasm with me. I've tried everything, more time, more force, but nothing works. I feel like a failure." His wife, Anne, a 48-year-old teacher, told me with tears in her eyes, "It's not that I don't love him, doctor, but after so many years faking it, I don't know how to tell him the truth anymore." This pattern repeats constantly. The frustration, the shame, the silence. Robert wasn't a bad lover. Simply nobody had taught him that a different, more effective way exists. When I explained the Coital Alignment Technique to them, they both looked at each other with hope for the first time in years. 3 months later, Anne called me excited. "Doctor, you won't believe it. For the first time in my life, I'm having regular orgasms with my husband. Robert feels like a new man. The solution isn't in more force, more speed, or searching for a mythical G-spot. The solution is smarter, gentlemen. It consists of understanding that penetration and clitoral stimulation don't have to be 2 separate things. They can and should occur at the same time. And that's exactly what the Coital Alignment Technique solves. It's not about reinventing the wheel, but aligning it correctly, so the journey is incredible for both. But before getting into the heart of the matter, let me tell you something important my patients have taught me over these 25 years. The best technique in the world is worthless without love, without emotional connection. I've seen many men come to my office obsessed with the perfect technique, as if sex were an exam they have to pass. And I tell them the same thing I'm going to tell you now. Women don't want a programmed robot. They want a man who loves them, who listens to them, who's present. The technique I'm going to teach you today doesn't replace love, friend. It's a tool to express that love more effectively. It's like when you bring your wife flowers. It's not just the bouquet, it's the gesture, the intention, the affection behind it. You get me? So let's continue. Okay, we've got the problem. Let's talk about the solution. The Coital Alignment Technique, or CAT as we'll call it, isn't some social media fad. It's a well-researched method that was introduced in 1988 by psychotherapist Edward Eisel. His goal was simple but revolutionary, to create a position that naturally integrated clitoral stimulation during penetration. The principle consists of flipping our way of thinking, from thrusting to rocking with pressure. Instead of focusing on how deep you go, you focus on establishing constant rhythmic contact between the base of the penis and pubic bone with the clitoris. Basically, you turn your own body into the perfect pleasure tool. And no, I'm not making this up, science confirms it. An important study published in the Journal of Sex and Marital Therapy showed incredible results. 56% of women who claim not to have orgasms with traditional missionary position sex achieved it with the Coital Alignment Technique. That's not a small improvement, gentlemen. It's a radical change. Experts like urologist Dr. Rina Malik recommend it and explain that it's scientifically proven to increase orgasm probability. Studies don't just report more orgasms, but also more simultaneous orgasms, which gives you an idea of the degree of synchrony and intimacy achieved. CAT works because it attacks the root of the anatomical problem. It doesn't leave clitoral pleasure to chance, but converts it into a guaranteed part of the act. The rocking movement generates constant, pleasurable friction that keeps arousal high and stable instead of the ups and downs of conventional sex. It's important to understand that CAT isn't just missionary too, it's a different movement philosophy. Both partners no longer have to see sex as a race to the finish, but as a dance, a rhythmic and connected dance, where bodies move as one to feel pleasure together. I met Charles and Mary, a couple ages 58 and 55 from Boston. After 30 years together, they confessed their sex life was practically dead. Charles told me, "Doctor, at our age, I don't know if it's worth trying anymore." Mary nodded sadly. When I taught them CAT, Charles was skeptical. "Do you really think after all this time this will work?" I answered him, "Charles, precisely at your age this works better. You're not in a rush anymore. You can take your time. Really connect." 6 weeks later, Mary arrived alone at my office with a radiant smile. "Doctor, I brought you this," she said, handing me a box of chocolates. "Charles was too embarrassed to come, but wanted you to know you've given us back something we thought was lost forever. Not just sex, but intimacy, connection." Last night, we had our first simultaneous orgasm in 30 years. This approach is also perfect for slow sex, that practice where connection is more important than speed. By eliminating performance pressure, the couple can focus on sensations and thus create much deeper intimacy. And let me tell you something more, friend. In my experience treating older men, adults like us, this technique is a blessing. At our age, we don't have to prove anything to anyone anymore. We can take our time, enjoy the moment, really connect with our partner. That's what women value, believe me. Well, let's get back to our goal. I'm going to guide you step by step. And remember, perfection on the first try isn't the key. The key is communication, patience, and practice. It's a new dance and you're going to learn it together, you and your partner. Step 1, preparation and positioning. Everything starts like the missionary position, but with some small adjustments. She lies comfortably on her back. First professional tip: place a firm pillow under her hips. This elevates her pelvis, changes the angle, and moves her clitoris naturally toward you. Just this small gesture intensifies contact. Now her legs. In traditional missionary, they're normally open. Here it's the opposite. She should keep her legs closer together or even wrap them around yours. This creates a kind of embrace with her thighs that concentrates pressure and friction. Step 2, perfect alignment. Now it's your turn, gentlemen. When you're on top, your legs don't slide between hers, but outside hers. And here comes the most important adjustment. Slide a bit higher than normal. Your goal is for your pubic bone to be directly over her clitoris. It's not about crushing her, but establishing firm and present contact. Your hips should be pressed against hers. You should feel how your bodies are connected without airspace. This alignment is what gives the technique its name. Step 3, the movement. The secret is in the rocking. This step changes everything. Forget the classic in and out thrusting. Here the movement is a rhythmic rocking like a seesaw. Imagine your pelvises are connected and move as a unit. You begin a smooth movement, moving your hips up and down, not back and forth. As you do this, the base of the penis and your pubic bone rhythmically rub her clitoris, generating constant stimulation with each movement. Penetration is a consequence of this movement, not the goal. The goal is friction. She's not passive, friend. She should respond to your movements by rocking her pelvis rhythmically upward to meet you. It's a synchronized dance. When you descend, she rises a bit. When you rise, she descends. Some describe it as a small, very controlled circular movement. The key is maintaining body contact at all times without separating. Step 4, rhythm, patience, and communication. This isn't a race, gentlemen. It works much better if you start slow to find the rhythm. Feel the contact, the pressure. Communication here is everything. Ask her, does this feel good? More pressure? Slower? And she should guide you. Yes, just like that, keep that rhythm. Once you've found your flow, you can play with speed. But remember what Dr. Malik says. Having orgasm as a goal generates anxiety and is counterproductive. The goal is to enjoy the journey. What's beautiful about CAT is that the process itself is incredibly pleasurable, and orgasm is a natural consequence, not a forced goal. I had a patient, James, a 47-year-old lawyer from Houston. He arrived frustrated after his new partner, Laura, confessed she'd never had an orgasm from penetration in her 45 years of life. "Doctor," he told me, "I've read everything online, tried everything, but nothing works. I feel inadequate." I taught him CAT step by step. The first time felt clumsy, he confessed later. We laughed a lot because we couldn't find the rhythm, but we didn't give up. On the 4th try, something clicked. We found our dance, James told me with shining eyes. And then it happened. Laura had her first penetrative orgasm in her life. She cried. I cried. "Doctor, I didn't just give her an orgasm, I gave her confidence in her own body, and she gave me the satisfaction of knowing I can truly please her. Don't give up if it doesn't work the first time. It may feel a bit mechanical at first. Laugh if something goes wrong, but don't give up. Each attempt will help you understand each other better, and believe me, it's worth the effort. When you get the hang of it, there are some advanced tricks and common traps you should avoid. Common mistake number 1. Activating autopilot. The easiest mistake is returning to the old thrusting movement. We've been doing that movement for years. To avoid it, pause. If you feel you've lost body contact, correct the movement and return to slow rocking. Common mistake number 2. Uncomfortable silence. He assumes everything's fine because it feels good for him. She doesn't say anything to avoid hurting his ego. That leads straight to failure. CAT is 100% teamwork and requires feedback. Simple phrases like a bit higher, slower, or just like that are worth gold, friend. Common mistake number 3. Giving up too soon. We tried it and it felt weird. I've heard that 1,000 times. Coordination takes time. Don't see it as failure, but as practice. The reward for persevering is enormous, I guarantee it. Advanced tip number 1. Lubricant is your best friend. Although the technique is based on external friction, a good water-based lubricant is essential. It not only facilitates penetration, but makes rocking much smoother and more sensual. It intensifies sensations for both. Don't underestimate it, buddy. Advanced tip number 2. Don't forget the rest of her body. This position allows you absolute intimacy, chest to chest, face to face. Take advantage of it. It's the perfect moment for kisses, whispers in the ear, or caresses on the back. Use your hands. Multiple stimulation can increase arousal exponentially, and believe me, at our age, we know sex isn't just what happens down there. It's the whole body, the whole person. Advanced tip number 3, experiment with variations. Once you master the classic technique, you can try variations like cowgirl or woman on top. She can control movement and pressure with absolute precision. The principle is the same. Instead of bouncing, she performs a rocking or grinding movement, maintaining constant contact. And let me tell you something, many women love this variation because they have more control, and we men can relax a bit and enjoy the show. I met Patricia and Michael, a couple from Phoenix, ages 62 and 65, respectively. Patricia had gone through menopause and believed her sex life was over. Michael confessed they'd gone 2 years without intimacy. When I told them about Kat, Patricia was skeptical. "Doctor, at my age, the body doesn't respond the same." I explained that precisely because of that Kat works so well. It doesn't depend on extreme natural lubrication or flexibility. It depends on connection and contact. 3 months later, Patricia came back radiant. "Doctor," she said, taking my hand, "I'm 62 years old and just discovered what a real orgasm is. For 40 years, I thought something was wrong with me. Michael and I feel like newlyweds. Last night, we made love for an hour, unhurried, connected. It was the most beautiful experience of my life. We've talked a lot about mechanics, but it would be a mistake to limit Kat to just orgasm. Its true power is in how it redefines the couple's connection. Sex, that focuses exclusively on thrusting, can be a disconnected, almost solitary experience. Kat naturally forces you to connect. The need to synchronize, to move as a unit, requires a level of mutual attention that few positions achieve. You're face to face. You feel each other's breath. You feel her heart beating on your chest. The slow rhythm creates space for emotional closeness, not just physical. A constant dialogue is created between bodies. For a man, learning and applying this is an incredible act of generosity. It shows he's willing to unlearn and prioritize his partner's pleasure, and that gesture alone works as a powerful aphrodisiac. Believe me, for women, achieving orgasm regularly with their partner is incredibly empowering. It closes the orgasm gap and eliminates that feeling of being broken that some women experience. In the end, Kat is more than a technique, friends. It's a means of communication. It's a way to be 100% present for each other. It's a way of saying, "I'm here with you and your pleasure is my pleasure." And that connection is often more satisfying than any orgasm. After 25 years as a urologist, treating thousands of couples, I can tell you the happiest relationships aren't those with the technically best sex, but those with the best connection. And Kat helps you achieve both. And there you have it, gentlemen. We've demystified a myth, understood key anatomy, and I've given you step by step a proven technique to transform your intimacy. In the end, it comes down to this. Technique is crucial, more than size, more than stamina. Understanding your partner's body and knowing how to use it to give her pleasure is the most important sexual skill you can develop. The Coital Alignment Technique is about moving from monologue to dialogue, from race to dance. Now the question is, are you going to keep on autopilot maintaining habits that don't work for your partner? Or are you ready to use this knowledge and change the experience for both starting tonight? You decide, friend. Thank you for being here with me. If this video helped you, subscribe so you don't miss more content like this. And leave me a question in the comments. What was the most surprising fact we talked about today? I'll read them all. Until next time, gentlemen, take care.